So today we have with us Dr. Devan Millard. She is the Hospice Medical Director for Applegate HomeCare Hospice. Thanks for being with us today.
Yeah, thank you.
So we have a couple of questions, just more to get to know you more than anything, and we'll just get right into it.
Okay.
The first question we have is, can you tell us a little bit about yourself and your background in medicine?
Yeah, sure. I grew up in Las Vegas, Nevada, and then came to undergraduate school at the University of Utah. So I did college there, and then went back to Nevada for medical school. So went to the University of Nevada, Reno for med school, and then came back to Salt Lake. So a little flip-flop, back to Salt Lake for residency, which I did in family medicine. I finished up there in 2013, and then I stayed on as faculty for a couple of years and did primary care, and then transitioned to doing hospice and palliative care, which I've been doing now for the last 10 years.
Oh yeah, that's awesome. Love it. The next one is, what do you enjoy most about working in hospice care?
I think that most people who go to med school, most people who end up, becoming doctors, at the end of the day, we want to help people. And I feel like hospice is where I can do that the most. I feel like with hospice care, it's truly, we put the patient first. The patient is the captain of the ship, and they get to, really determine how their care is going to go. And I love that hospice has everything automatically included. When you enroll in hospice, you get your nurse, you get an aide, you get social workers, you get chaplains, you get sort of this whole person picture. And I feel like most of medicine doesn't nail that like hospice does. So I love that aspect of it.
Yeah, that really is beautiful. What is your approach to patient care, and how do you support patients and their families during difficult times?
Well, my approach to patient care with hospice patients for sure is that they are the boss. They get to kind of decide how this is going to go. They're obviously dealing with a lot. Patients on hospice have a terminal illness, and we expect their life expectancy to not be very long. And so they're sort of dealing with all of the spiritual aspects of that, lots of physical changes happening, and I love that with hospice I get to spend time with patients. I can spend a couple hours at their house, getting to know what's important to them, how they want this to look. You don't get, multiple hours with patients in almost any other field. So I appreciate that. I appreciate getting to know them. I appreciate getting to know, little facts that, like, their dog is their best friend, and they want their dog by their side, and they want to, remain at home for the end of their life. I like to know those details, and I like to be able to help patients sort of have the end of their life look exactly the way they want it.
That's awesome. I love that. What advice would you give to someone considering hospice care for a family member?
If you think you're getting to the point where you need hospice care, talk to your primary care or your main doctor, the doctor that's been kind of taking care of your, most of your serious medical issues. Talk to them about it. See if they think that you fall in that timeline that we've sort of reached, maybe the final phases of your life. And just know that hospice is it's a very special type of medicine where we really get to focus on keeping you comfortable and sort of making this phase of your life as comfortable as it can be.
Perfect. Well, sweet. Thank you so much, Dr. Millard.
Thank you.